Welcome to another episode of Healthy Moves, where we talk about everything that keeps you moving and thriving. I'm your host, and this episode is compiled by Dr. Manish Shrestha. And today, we're diving into a topic that hits close to home for millions: low back pain caused by a prolapsed intervertebral disc. Imagine this: you're bending to tie your shoes, or maybe you're lifting a bag of groceries, and suddenly you feel its sharp, radiating pain shooting down your back. It stops you in your tracks. You're frozen, not from fear, but from the searing agony of a collapsed disc. Sounds familiar? You're not alone. So, what exactly causes that disc to slip out of place? Well, the spine is like a stack of jelly filled donuts. The discs between your vertebrae act as cushions, allowing smooth movement. But when one of these discs herniates or slips, it can press on nearby nerves, triggering that excruciating pain we all dread. The main culprits: poor posture, lack of movement, obesity, and yes, even lifting things the wrong way. Age, unfortunately, doesn't do us any favors either. But here's the good news: you can take control. Let's talk prevention. Before that, please like and subscribe for more health related tips in the future. Number one, maintain a strong core. Your core muscles support your spine like the frame of a house. Weak structure. Exercise is your friend here. Simple planks, bridges, and pelvic tilts can do wonders. Number two, be mindful of your posture. Sitting hunched over your phone or computer, that's putting you on the fast track to back problems. And number three, lift properly. Bend at your knees, not at your waist. And always hold heavy objects close to your body. But what if prevention is too late? What if you're already dealing with a prolapsed disc? Don't worry, there's hope. Treatment starts with conservative methods, physical therapy, anti-inflammatory medications, and most importantly, exercises tailored for recovery. Let's break down some effective exercises you can start today. First up, the Mackenzie extension. Lie on your stomach, place your hands beneath your shoulders, and gently press up, arching your back. This technique can reduce pressure on your spinal discs, creating space for that nerve to breathe again. Then, we have the cat-cow stretch, a favorite in yoga. On your hands and knees, arch your back upwards, tucking your chin, then lower it, bringing your belly down towards the mat. It's all about creating movement in your spine, relieving tension. Finally, there's the pelvic tilt. Lie on your back, knees bent, and flatten your lower back to the ground by tightening your abdominal muscles. Repeat slowly. This simple move strengthens those deep stabilizing muscles. Now, when conservative treatments aren't enough, more invasive options like steroid injections or surgery might come into play, but that's always the last resort. Remember, the key is consistency with your exercises and maintaining that core strength. Before we wrap up, here are some fascinating facts about low back pain, specifically in Nepal. Living in high altitude regions can worsen back pain due to lower oxygen levels, making it harder to maintain good posture. In rural Nepal, traditional habits like carrying heavy loads in a bent over position or sitting on the floor for long periods put extra strain on the spine, increasing the risk of slip discs. Interestingly, despite the use of yaks and mules for carrying loads, many people still carry significant weight themselves, risking spinal injuries. On a brighter note, Nepal's connection to yoga and Ayurveda provides natural therapeutic options, with poses like cobra and child's pose helping alleviate pain. And while urban areas have modern treatments, rural populations still rely on traditional healers, showing the need for better access to healthcare services. Next time, we'll discuss something many of you have been asking for: the truth about knee arthritis. What causes it, how to prevent it, and the best exercises for joint health. Stay tuned for that. Thank you for joining me today on Healthy Moves. I'm Dr. Manish Shrestha, reminding you to keep moving and stay healthy. Catch you in the next episode.